so I'm just gonna start again. Hello, everyone. For those who don't know me, my name is Gabbie, and for those who do, hello. Forgive me in this video if I say a lot of ums and likes. This is, my first time doing a video to put on the internet. So the main reason I wanted to make this video was to talk about a genetic disease that is pretty rare. And I just wanted to basically talk about my experience, and hopefully this can, reach people that may be affected by this disease, or may know someone that is, or could be affected by something similar. And I just want to talk about my experience, and hopefully that can help some people. I don't know. So I just wanted to put it out there, at least. So I'll start with who I am. Again, my name is Gabbie. I'm 26 years old, and I was diagnosed with VHL this year. That's the acronym for the official term. It's called von Hippel-Lindau. And it's a genetic disorder that has ran in my father's family. My father had it, and his mother, my grandmother, had it as well. And to be honest, while growing up, I really didn't know much about it. I really didn't even know what my father had or my grandmother had until I got a little bit older. So that's when I became aware about it and the possibility that I may have it. So when I became aware of it, of course, I asked questions. I don't believe that I asked my dad much about it. I don't think he really liked to talk about it much, but I did ask my mom. And I think at that time, that was kind of after when my dad had passed. He passed, I believe, in 2011. He was 39, sadly. Pretty young, but still had a short time with him. But of course, I still love him nonetheless. And I enjoyed the time that I had with him. And anyway, so when I asked, some questions about it, I mainly asked my mother about it. And, she told me kind of a little bit of what she knew. I don't know if I know that it wasn't all the information, of course, because really at that time, especially, there wasn't really much research on VHL, especially where we were from and where we were living in. We were living in Mississippi at the time. And my dad was also from Mississippi, from Jackson. And he was getting, I guess, treatment there. And there really wasn't, again, any research done on it or people that knew much about it. So they could only treat it I guess they treated it like cancer. So that's how they kind of approached it. And there wasn't much to do with it. And I'll explain a little bit more about it. The VHL, it's a genetic disorder or disease, whatever you want to call it. It's what it does is that it mutates your genes, which will make tumors form inside your body. And depending on what type of VHL that you have, and I didn't learn this until this year, that apparently there's two different types. There's type 1 and type 2, and then if you have type 2, you have 3 other variants of that type. Like you have either type A, B, or C. I don't know what type variant I am in that category. I do know that I'm type 2, and type 2 falls along the lines of it being sporadic, like where the tumors would be. And then I believe type 1 is kind of like you'll only kind of form tumors in your abdomen area, and it could be few, it could be more, it just depends. So yeah. I don't know all about it. I'm still kind of learning because again, as I was a child, I only asked a few questions, and along with what my mother had told me, she also, told me that when I was a child, that was when my dad had gotten really sick, and that's when he started to show symptoms, and I believe he got diagnosed around that time as well. So, and he was I think he was 25 or 26. I can't remember what age they said, but it was around the same age that I am, right? So she said that when I was a child that The pastor came at the church that they were at, and along with my grandmother, my mom, when I was born, they prayed over me, and they believed that I didn't have it. They said that they believe God, spared me from this disease. Or I guess I put that in my own words. I wouldn't say they said that specifically, but I think they said that, they believed that I didn't have it. And so I kind of, went through life, not really putting that on the forefront of my mind, which I believed is a good and a bad thing, kind of, because it kind of led me to like not really consider that until I started to feel symptoms, like, I guess in the past year, but mostly recent of this coming year, at the start of this year. I mean, when I was a child and as I was growing up, I kind of believed and wanted to believe that, I wouldn't be affected by this disease. So I really didn't start to feel any symptoms or start to really kind of think like, okay, maybe I should get at least tested for this. Because of course I was having headaches for years, like ever since high school. Like I thought it was always like a migraine, like how people, we tend to have headaches a lot, and it could be due to stress, it could be due to dehydration, hunger, like maybe you're just hungry. And I would always think when I would have these headaches, because I was, as a teenager, you don't always eat properly, so I wouldn't always eat all of the time, mainly because sometimes I just wouldn't be hungry. So I sometimes also forget to eat as well. So I would probably, if I wouldn't eat breakfast, I would probably skip lunch and just like not eat anything since breakfast, and then eat something at dinner. I may snack here and there, but it would never be like a a meal or something. Or if I didn't eat breakfast, I would just wait until maybe lunchtime, eat something, and then maybe eat dinner. It just depends, right? So I wasn't always eating like a balanced meal 3 times a day, if that makes sense. So yeah, I would always contribute to like my headaches to be something that was fixable. Like, okay, well, I'm stressed, maybe I just need to lay down and take a nap or something. Or maybe I'm dehydrated. Did I drink water today? No, I didn't. So maybe I need to drink a couple bottles of water. That it would always be that, right? And sometimes I felt that, it was those things, right? And then there would be times where the headache, even if I did all of that, nap, food, water, or something else, right? Like stretching or anything like that, like it wouldn't help. So I would, go ahead and just take an ibuprofen or an Aleve to help with that. And again, that was kind of like for me the last resort, because I don't really like taking pain medication, but I guess over the years I've my body has built up a tolerance to it, because up until this point it had been working until it wasn't, right? So up until this year, I started to feel, I guess I should talk about the symptoms that I should have been paying more attention to, and that should have prompted me more to go to the hospital instead of waiting until, I guess the last minute type of thing. But I don't think it was the last minute. I think it was at the right time. But anyway, let me talk about the symptoms. So the headaches, when dealing with this, can be an obvious sign. I'm not saying that, for, I guess, quote unquote regular people, that you automatically assume, hey, there's something really wrong, right? And you probably need to go to the hospital and get a CT scan and stuff like that. I'm not saying that. It may be just those things I was talking about earlier: stress, hunger, dehydration, stuff like that. But in my case, right, and with my dad's history, I should have paid more attention and considered the fact that maybe it could be this more, or consider that maybe to be the second thing and not the very last thing. So what I was experiencing was, of course, the headaches, and I've had those for years, and they would come and go. Honestly, they wouldn't be so consistent. Like I was dealing with head pain every day, every single day, every single minute. It wasn't like that. It would really just come and go. And another symptom that I started to experience this year was dizziness. It would start off very subtle. It would kind of be like if I got up quickly, it would kind of feel like whoa type of thing, and it would only last for a few seconds. And so at the time, I really didn't think that, again, it was this. I was thinking like, okay, well, maybe I just need to slow down when I stand up or when I sit up, because I, again, contributed that to maybe dehydration or something. And the dizziness progressed over some weeks. And again, I wasn't thinking about this, and I was thinking okay, it may be an ear infection or something. I was like, okay, maybe I need to go to the doctor to get this checked out, because it's possibly that I really didn't consider VHL until I started to feel off balance walking. And that's another symptom. At the time, I felt like I was walking normally, but I found that I was kind of leaning to the right more, and I was running into doors and door frames, which I feel like I never did before. And I took note of it and I was like, okay, this isn't really normal. And mind you, all of these stuff I was mainly keeping to myself at first because maybe it was denial or simply I just wanted it to be something, I wanted it to be something else other than the very serious disorder that it could be at the time, right? So, yeah, just everything, those three things I would say that stood out to me, right? That I should have considered to be like very, very serious, and I should have went to the hospital sooner, right? But as I continue on, it made me understand why I didn't go. Like, I understand the choices I made, right? They delayed it for a reason because I ended up here in Maryland where they specifically, treat patients that have VHL. They have a clinic for that, and the patients that are in it, they are on this medication, and from what the doctors say, that this really helps patients with VHL. And I'll go more about that later, but I just realized that being in Mississippi at the time, it wasn't the right place for me to, I guess, have all this happen, which I'll divulge more as I go on. So those are the symptoms that I was experiencing the most that did send alarm bells, and I did go to the doctor. So I went to a PCP, just a regular like clinic, because at that point I did kind of tell my mom eventually like everything that was going on, and she had been asking me to go get tested a couple years ago. At first, like when I wanted to, at high school, going back, sorry, I wanted to get tested then because I just wanted to know. It's not like I was kind of experiencing stuff that I was experiencing this year, but I just wanted to know, like, did I have it or not? Because at the time I really thought that that would kind of shape my future. And her at the time, my mom, she thought that that would kind of make me want to hinder whatever, I guess, whatever was planned in my life, or whatever I thought I wanted to do. She thought that maybe I didn't want to do it since I could possibly have a diagnosis like this. And I honestly couldn't tell you if that would be true or not. I don't think so, right? But I understand her perspective is just like, let's delay that. Let's not, get some news that you may not be ready to hear type of thing. Especially I was still so young and fresh out of high school. So I can understand why she felt that way. So I did, put a hold on it because, again, at the time, I really didn't feel like that anything was wrong. I felt fine. So I kind of, again, just lived my life as if it was fine. So anyway, back to when I went to the doctor. I was still in Mississippi at the time. I went to a clinic and I was telling him about the stuff I was feeling, and I went there so I could get a referral to get tested for this disease, because you can't just go into a hospital and say, hey, I need a genetic test for this. You have to get a referral from a doctor. So that's why I went to him, and also to, I guess, rule anything else out. And he wrote me a referral. So I was kind of in the process of getting tested, or trying to get tested for this, right? And while that was happening, me and my partner, we were gearing up to come here to Maryland for a trip. It was a trip for me, honestly, because he had joined the military last year, and he got, what's it called, assigned or transferred here to Fort Meade and in Maryland. So he wanted to come out here. Well, he had to come out here, and he was looking for a place, right? Because he'll be moving out here, right, at the time. So I just came out here basically for support and to help him find a place and to make sure he got settled and whatnot. And I was gonna come back home, right? I wasn't thinking about living out here until maybe like a year or so after everything, but it clearly didn't work out that way. So moving forward, after going to the doctor, getting a referral, I was getting ready to, hit the road with my partner, and we got here. It was like a 16-hour drive. So we got here, got at the hotel. We were, sightseeing. We were, excuse the car if you heard that. We were sightseeing. We were, just kind of exploring Baltimore and the cities around it as well. At the end of February, right, where we were still, in the hotel and still looking for a place, and we were kind of in between two places. We were trying to choose for him, and something happened at the hotel. Well, I'll say for me. So again, back to the symptoms I was feeling, right? I was still feeling them while we were here and ignoring, but again, they would kind of come and go, and I wouldn't feel it consistently, right? So I, was trying to, what's to say, grit and bear it type of thing at times when I would feel it. So I wouldn't try to make a big deal about it, mainly because I didn't want to make a big deal about it. He was, concerned about me, especially when it came to my headaches. He didn't think it was normal that I was, experiencing like more headaches consistently. So he was kind of worried about that. And I would kind of, I guess brush it off or just paint it as like, oh, I probably just didn't eat, enough today, or I was dehydrated. So yeah, don't do that. Don't do that. Do not diminish your symptoms. Don't try to make light of it. What happened? It was one night, we were in the hotel. I had a really bad migraine and it would not go away for anything. It wouldn't go away. I tried again, like the same thing, tried to eat something, tried to drink some water, tried to take a nap. That didn't work. And usually I feel like naps or sleep would help, with stuff like that. So when it didn't, I was like, man, why is my, because it was in the back of my head, like the very back. And I was like, man, like this is not going away. Ding, ding, ding. Go to the hospital, Gabbie. No, and apart from that, me as a person, I just don't like the hospital. As a kid growing up, seeing my dad in the hospital, my grandmother, a whole lot of stuff wrapped into like this box of, I just don't like the hospital. I don't like the atmosphere, I don't like being there. So I wanted to avoid it at all costs. So what led me to going to the hospital is what happened, because when I was, again, having that very intense migraine that wouldn't go away, it was getting closer to the evening that night. My partner had went out to get us some food. He came back, he ate. I didn't because I just wasn't hungry, but I was trying to, I don't know, psych myself up to like at least eat something, because I just, how you're not supposed to go to bed on an empty stomach, right? That's, the saying that I grew up with, that I think most people have. But yeah, I was just like, okay, like even though my head's hurting, I need to sit up, because it was hard for me to sit up. The TV, the light from the TV, my eyes were very sensitive. So I was like covered in my blanket over my head. I just felt miserable, So it was pretty late by the time I finally sat up and was ready to eat something. And then when I sat up, the only way I can describe it is like, when you're about to be sick, like about to throw up, right? That's what I was feeling. And like the salivating in your mouth, that feeling. So it was all kind of instantaneous. And I shot up, went to the bathroom, and I spit up in the sink. And after I did that, that's when I felt it coming. So I went straight to the toilet, and I was just, very sick. And I hadn't felt that way in like a really long time. And in the moment, again, don't do this. Don't minimize, your symptoms. So in the moment, I was like, okay, maybe it was that sandwich I ate earlier, because I was attributing to what was going on with like some sort of like food sickness or food poisoning, because the last time I felt sick like that was when I ate something that probably wasn't right, and that's why I was sick at the time. So that's what I thought was going on. And again, my partner was there. He came in, was holding my hair, rubbing my back, and he was like, are you okay? Like, do we need to go to the ER? And I was like, no, because again, I don't like the hospital. And it was late, and I was thinking in my head like, okay, well, if I feel sick again tonight, yeah, we'll go. If not, then we'll go tomorrow. And that, I guess calmed him down a little bit, or made him feel assured that, okay, we'll still get some help, right? Or I'll still get some help. So yeah, that night after I, went to the restroom, I did feel a little better. So I thought like, okay, maybe I just needed to throw it. Maybe I was just feeling sick. Don't do that. It just wasn't clicking for me. I don't know, like I'm not stupid. I know I have common sense, but I was acting stupid in the moment. Like it was the stubbornness, about me. Like I don't want to go to the hospital, and me still not trying to make a big deal about things. And so yeah, after that night, I did feel a little bit better. I still kind of had a little headache at the back of my head, so it wasn't completely gone, but I did feel a little relieved, right? So the next day came, and it was getting close to noon, and I decided like, okay, like I've been going over in my head, go to the hospital. So we go to the ER. Now from this point, that's when, I don't know, everything just goes downhill in my eyes. Like that's where like everything changes. Like me deciding to go to the ER. So go to the ER. I'm sure a lot of people know that it's a long process. A lot of people go to the ER for many different things. So I see the nurses, the nurse practitioner. They write down my symptoms. I tell them about my dad's history, that I'm looking to be tested for this soon. So just, I guess, add that in as like a possible factor. Again, at the time, I was still hoping that it wasn't it, but I was kind of preparing my mind for the worst answer, or like the worst thing that could happen. And evidently it did, because I went through the whole process of getting blood drawn, getting tested, well, like a panel, whatever they call it, I'm not really sure. I went to get a CT scan and all of that. So we were eventually brought back. The doctor, I meet the doctor, she comes in. Still a nice professional lady, but I had a feeling that she didn't have good news. So when she came in, she told us that, you know, they looked at the scans, they found masses in the back of my head, which, I mean, subconsciously, again, I know I was preparing myself for the worst, hoping for the best. And when she, you know, said the worst, I was like, you know, okay. I wasn't smiling at the time. I was just like processing everything. So she said that, and she said she also sent the scans to a doctor at Johns Hopkins, and he confirmed that, you know, it's VHL. Well, his I guess educated opinion, because he's dealt with patients that have VHL before, and I guess he recognized it. So he was like, yeah, that's it. So she said that they're gonna send me to do another scan, but an MRI scan, which I guess is supposed to enhance the picture so they can, you know, look at it and view it more clearly. So that's what I did. After that, they said, yeah, that's it. We're gonna have you transferred to the Johns Hopkins hospital so they can, I guess, take better care of you, because the hospital that we went to was an adjacent hospital of Johns Hopkins, but it wasn't like the official hospital. So yeah, finding out all that information, it was very, very shocking, and I was, you know, a little disappointed as well. At the time, looking back now, I can say that I was disappointed in myself, because I felt like I should have been more attentive about my health. I should have considered that to be more of a possibility than other things, right? And I was trying not to blame myself for everything, because evidently I believe things happen for a reason. So yeah, we find out that information. And meanwhile, while I'm at the hospital, I did let my mom know about that I was going to the ER, and, you know, why I was there, and I kept her up to date about everything. And then I eventually had to tell her what I learned from the doctor. And she was currently in Florida because of a unfortunate thing that happened with one of my cousins. They had unfortunately passed away, and my family went down to Florida for a funeral, for the funeral. And so it wasn't, you know, in my opinion, it wasn't a good time, but I couldn't like not tell her, because I did, before I had left to come up to Maryland, I promised her that going to, you know, again, diminish any of my feelings or symptoms. So I'll just tell her if something's wrong, right? Because a parent does need to know. They do need to know. So anyway, yeah, I did tell her about that. And while she's down there, I'm up here, and we're in the opposite ends of the country. Yeah, it was a lot. It was a very emotional time. Trying not to cry. Ooh, okay. Because just a lot was happening. It was just like, I don't know the right metaphor to use, when everything is just coming at you at once, and life really just sucks, and it just really hits you in the face. So I remember just in that moment talking to my mom on the phone. It was very emotional, like I said, and at the time that day, I was kind of holding in all of my emotions, because, you know, the doctor comes in and tells you that, yeah, there's something really wrong, and it's the very thing that you don't want at all, and it's happening to you. So yeah, it's shocking, and I guess it hurts. So yeah, it was a very, very, very emotional time. Anyway, so after that phone call, we were still at the ER, or the hospital that was attached to it, and we didn't leave there till like around 1. or 1 o'clock in the morning because we were waiting on an ambulance. They wouldn't let me leave the hospital because I guess of my condition and how serious it is. So they were like, nah, like the only way you can go to the other hospital is if you're transported by ambulance. So that was that. So we get there, it's late. My partner can't stay with me because it was way past visiting hours, and they had put me in the NICU. So yeah, I was after a while I was alone after the nurses came in, and I had to change it to the gown and get pricked for blood, and they came and did all kinds of stuff before I was allowed to go to sleep. Like they did x-rays and all, just a whole bunch of stuff. Anyway, I was just kind of just thrown into it. It was really a lot. So I finally was able to go to sleep. It wasn't until like maybe 3 o'clock in the morning. I woke up again around 6, so I didn't have much time to sleep. That's when a team of neurosurgeons came in, and they made me perform some tests, like neurological tests, and explained to me that there's a tumor on my cerebellum that is affecting and making me sick and all of this stuff, right? And I'm like, okay, processing everything. And the main doctor who was telling me this, right, was saying that they're gonna put me on an NPO, and that they're gonna be prepping for surgery in a couple days. And I was like, whoa, what do you mean? Whoa, slow down. I just got here. And it's like, I was trying to explain to them, like, hey, like, I'm not from here. Like, all of this just happened, and this is all very new information, and I'm just trying to process everything. So he's talking about surgery in a couple days, and so I was like, I gotta call my mom. I had to call my mom because what are you talking about, surgery? Whoa. So after talking with them, and I kind of explained a little bit of my side, he was, I guess, like, okay, well, you can discuss it with your mom. And I did, and she was like, at that point, she was already determined to come up here and to be here and I guess to see the doctors and also have more information as well. So she was kind of like also waiting for me to tell her what was going on too. So I did, and yeah, she was like, we're not going forward with surgery right now. What are they talking? It was the same as me. I was like, I don't know. But of course, we're in a hospital. That's where healthcare workers are there to help you. So essentially the doctor was right, because after all of that, I talked to another doctor. He was the doctor that reviewed my scans and said that that's what it was, VHL. So he came in later that day, I believe, and, told me the same thing and said that, it is probably best it is going to be surgery. Like, you are not going to be able to avoid that. That's for a fact. But it's okay if you need, a couple more days or a few more days to figure out like exactly what you guys want to do and all that stuff. So they had discharged me the next day, and they prescribed me some sort of like steroid. It's called dexamethasone, and it was supposed to help like with the inflamed part of my brain, or the tumor that was inflamed, to help it calm down. So I guess I wouldn't be triggered again by any sickness or any headaches or anything like that. Taking that, it only worked for like 2 days, because honestly that's how bad it was. Because after those 2 days I was feeling the same things again, like the headache and the dizziness again. And so I was on that for about a week, and it was not fun. It wasn't fun because even though the steroid that they prescribed me was only 1 milligram, it was a lot, especially on my stomach. I won't go into detail, but just know that you're supposed to have some sort of, what's it called? A stomach liner pill that's supposed to help with coating your stomach before you take the dexamethasone, because yeah, it'll mess up your stomach. So anyway, I was on that for about a week. A week later, my mom was able to come, and my uncle also came as well because he wanted to be there for the appointment. And of course, my partner was there. I was there. We went to a follow-up appointment with the same doctor that reviewed my scans. And we get there, he reviews them again, and he's more concerned at this point. He was kind of like, the tumor itself isn't big, but the fluid that was around it was covering 90% of my cerebellum, and that's why I was feeling all of the things. And so he was like, this needs to be done very soon. He was kind of giving a time estimate of when I could possibly have surgery, because at that point I was like, I'm probably not still gonna stay in Maryland. I'm thinking about like, okay, I have to go home eventually, and I don't know where I'm supposed to have my care, because again, Mississippi, I don't think I mentioned this before, Mississippi doesn't have like any research facilities or any possible treatments that could help patients like me, right? So but given the fact that after the doctor's appointment after he gave us all that information, and he expressed it really major concern. He was looking at me with very much concern, and as if he didn't want me to leave the hospital at all. So he said that I maybe have a month to do surgery just so we can get it removed, because if the fluid starts to cover more of my cerebellum, the chances are higher that I wouldn't survive or survive the surgery. So leave the hospital that day, and apart from him being very concerned, he was very encouraging as well, and he also gave us more information about all of the stuff that was going on with me. And I forgot to mention that when I was what's it called, in the hospital, when you're a patient, when you're like inside the hospital, you're an inpatient, right? I forgot to mention that when I was in the hospital, I got a full body MRI. So it wasn't just the head this time, it was like my whole body, to check out to see if there's any more any more tumors in my body. And of course, I learned that there was more. There was not just the ones in my head, it was along my spine, my neck, down my spine, and my pancreas, right? So in total, as of right now, right, there is 13. Yep. And I'll go more about what the tumors are, and yeah, so learning about all the stuff that's going on with my body after doing the follow-up appointment with the doctor. Again, like I said, not only was he, expressing his concern, but he was also very encouraging as well, and was reassuring that, if I were to, have care there, that I would be more than taken care of and all of that stuff, right? So we left the hospital, and I don't think it was even like 30 or 40 minutes where we're right back there, because we come home, or we come back here because we eventually found a place, and we come back here, and I'm sitting in the car and I'm talking to my friends, and I'm sending them a voice message, and basically just updating them on what's going on with me and whatnot. So once I was done, I was getting out of the car, and that's when I said stuff hit the fan, because I got sick again, and it was worse this time. And I would say that was the point where I felt the most vulnerable in my life. I hate to use the word, but it's honestly how I felt. I felt pathetic, because when I got out the car, I just dropped to my knees and I just started getting sick again. And I couldn't even stand up on my own because I felt so disoriented. And my mom had came out, because she had came out to check on me early, because I was still sitting in the car, and I was like, oh, I'm fine. And I don't know if someone alerted her that I was on the side of the sidewalk just throwing up, or if, I don't know, her mommy senses came on or something. And she came on to check on me, and of course, I hate that she found me like that. I hate that she had to see me like that. I hate that anyone saw me like that, because I don't know what I look like, but I'm sure I didn't look good. So yeah, after that, went back to the ER, and I was still being sick, still throwing up. I did not feel good at all. The lights, even sunlight, was just very, my eyes were very sensitive. I just didn't feel good. I didn't feel great at all. And we were in the ER at that time, because we went to the hospital, Johns Hopkins, and yeah, we were in the ER. I don't know, I can't remember for how long, but we eventually, me and my mom, we were there at the time, and I believe my partner had to take my uncle to the airport because he had to go back for work. So it was just me and my mom there, and she was with me. I was getting fluids and all that stuff. They, how the ER does the same thing. And I remember my partner came back eventually after taking my uncle to the airport. He brought my mom something to eat, and all I can remember is that I was just trying to get some sleep. I was tired, so we were just sitting in the chair waiting for the nurse, I guess, to say when a bed is opened up, because they were gonna put me in. I forget the term. Help me out. And yeah, I just remember closing my eyes, and then the next thing I know, I'm in a hospital bed, stuff hooked up to me and all that. And from what everyone else has told me, my family, the nurses, all of that, saying that apparently I had a seizure while I was in the hospital, while I was sitting in the chair with my partner and my mom there. And I had no idea, because I was unconscious. I was unconscious, I didn't know. But anyway, that was just, another shocking thing, something that has never happened to me at all has happened or is happening. I don't know, I was just trying to wrap my mind around it. So yeah, after waking up in the hospital, seeing my family there, my partner, and yeah, it was, I don't know if it was surreal or not, I guess it was kind of. And it was also, it was just hard. But anyway, so I'm in the hospital at this point, and the doctors are telling me like, yeah, it was, the tumor again. It made you very sick. And so they were like, you're definitely having surgery, and it's not gonna be in a month. It's gonna be in a few days, actually. And I was like, oh, great. I can laugh about it now, but then I was not. So I was in there. I can't remember if it was a day or a couple of days, but I think, I don't know. It might have been just a day, because I remember it was nighttime, and they, the hospital, they serve, breakfast, lunch, and dinner. What was I saying? Yeah, so I remember it was one night where I wasn't eating dinner yet. Like, it was kind of just still sitting on my tray. And by that time, my folks had left, and I was, just there by myself. And I was feeling the same way that I had felt like a week or so ago before. Like, I really wasn't hungry, but I knew I had to at least eat something before I went to sleep. So I had tried to eat something, and I just took one bite, just one. Next thing I know, I'm throwing up again on the side of the bed, and I pass out. And apparently that's when I had another seizure, via what the nurse had told me, when I woke up the next day. And when I woke up the next day, I had some sort of like tube in my head, and they called it a drain, because they said that what was making me sick and having seizures was the fluid, the excess fluid that was in my brain, or that. So again, I was still shocking, and again, just trying to process everything. And I'll insert some photos, and be forewarned that these are sort of graphic. I don't think they're too bad, but I just wanted to at least show some pictures of what happened while I was in the hospital. And so yeah, so as you can see, that's what was going on. That was what was in my head, and it was in my head for during and after surgery, because once I did have surgery, they had to make sure that my head could withstand the pressure of the fluid that would, because like, much detail about that, because I don't remember much. Obviously, I was asleep. But after surgery, the doctors told me that everything went great. They were able to remove the tumor, so yay. And of course, they had to keep the drain in, because they needed to make sure that everything was, I guess, working properly again, and I would be okay to like take it out. So they did say that during surgery that there was so much fluid and pressure in the back of my head, apparently, that when they cut it open, it kind of just, like, a part of my skull disintegrated, because it was, it was just a lot of fluid and pressure against it. So they had to actually replace that part of my skull with a metal plate, like a little metal plate. I don't know the exact size, and I don't know exactly where it is. I assume it's like right here in the back of my head, right here. I'm just going based off touch and feel, but again, I don't really know. And also, the doctor said that they had to cut some nerve in my brain in order to get to where they needed to cut the tumor out, and that nerve would grow back in I guess a few months. And in the meantime, like, at the time, my scalp was numb. I didn't feel anything. So yeah, in the hospital for maybe a couple of weeks. And of course, family came to visit me. My uncle came, and my cousin Ryan. Hello, she's the one who will be helping me with this video as well. Yeah, I was very surprised that they came to see me, which was very, very I don't even know how to put it into words, but it was just very heartwarming, to see that people, care. And I needed that. I needed support. I really didn't realize how much I needed support. But when I saw it, I was very grateful, and still am very grateful. They discharged me, and I was able to go home. And from there, it's been an up and down process. Recovery wise, I've been doing well at this point. I'm doing very well compared to how I was, a few months ago. And I don't know if I have, well, I think I do have videos of when I was in the hospital. I don't know if I'll insert them in this video or not. But yeah. as of right now, I am doing well. There was, you know, a few hiccups here and there, but got back on track, I guess, in terms of my health. And all in all, to sum this up, because this is running pretty long, I did go see the VHL director in the clinic. That was at the Johns Hopkins Hospital. And I had so many questions, and he answered all of them, you know. And I don't know if I'll go over that right now, maybe later, but from what I know and from what he's told me is that, you know, I'm supposed to be getting started on a treatment, and it's a medication called Welireg. It seems to have worked well with many VHL patients, and he's pretty confident. He seemed pretty confident in the appointment, and also he's still pretty confident now when it comes to his other patients that he has treated as well. So I'm looking forward to it. I'm actually supposed to be starting it today. Today is August the 6th. I think so. I think it's August the 6th or it's the 5th. I don't know which one it is. But yeah, I'm supposed to be starting it today, and we're gonna see how it goes. In 3 months, I'm supposed to have updated scans. So at the 3-month mark, after I do the scans, I'll do another update on how I'm progressing and what I've experienced so far. So what I know so far and what the doctor had warned me about was that when I do take the medication, that there's a possibility that I could become anemic, because it has the possibility of, like, you know, lowering your iron. So before I take the medication, he had me do iron infusion, which is, I guess, supposed to help. Oh, well, he had me do the iron infusion, one, because I did labs before, and he said that I was pretty iron deficient. So I guess to bring my iron count up, I had to do that in order to take the medication. So we'll see how it goes. And yeah, I wonder if there's anything else. Anything else? As of right now, no. This is my experience on what happened this year and so far. So I hope me talking about this, talking about my experience, I hope that it helps someone that may be going through the same thing, or, you know, potentially help somebody from not, you know, going through this and being preemptive and preventing from having surgery at all, you know. Because again, this year was not on my bingo card. Like, what happened this year wasn't on my bingo card at all. I felt like I had a plan, you know, this year, and it did not go according to plan at all. So I learned that, you know, especially now that life happens. So be grateful for what you have, and always give thanks. And I have before, but it's even more so now, you know. But I guess that's it. Anyway, thank you for listening if you made it this far. Thank you for listening to my story. And if you are afflicted by this, if you know someone that is, or if you have a similar story, or know somebody that, you know, may have something similar, something like this, you know, it could be anything. You know, this is not strictly just about, it doesn't have to be strictly about VHL. This could just be, you know, you could be young and be affected by something, and something, you know, very wild happened to you. Like, it's, you know, please tell your story down below. I would like to hear it. And yeah, anyway, thank you for watching, and hopefully I get to see you guys in the next 3 months to give a positive update. All right, bye-bye.